The federal government says Canada will not receive any vaccine doses from Pfizer next week, a major setback for the country and for this province. Ontario Premier Doug Ford visibly frustrated today, and while he doesn't blame the Prime Minister for the delay, he says if he was in Justin Trudeau's shoes, he'd do things a little differently.
Every single day, I'd be up that guy's yin-yang so far with a firecracker, he wouldn't know what hit him from Pfizer. I would not stop until we get these vaccines. Other countries, small countries, populations of 5 million, we're part of the G7. We're a major player in the world.
A delay of this magnitude could set the province back for weeks. Even before it was confirmed that Ontario wouldn't receive a single Pfizer shipment next week, the province's vaccine task force was facing a significant reduction in supplies, including an average 50% cut in vaccines for the first 2 weeks of February.
Obviously, it is going to slow down what we can do.
Some hospitals have already run out of doses, and Ontario's first mass immunization clinic at the Metro Toronto Convention Centre will have to pause vaccinations immediately after just 2 days in operation. The province's target is still to vaccinate every resident, caregiver, and staff member of all long-term care homes in Ontario by February 15th. So far, they've completed first doses at 40% of them.
If we fall outside of 15 February, it will be because we do not have sufficient vaccines to complete it prior to then. I'm hoping that we can still do it. We're going to be really close one way or the other.
But they say the first round of vaccinations are complete in the 4 hotspots: Toronto, Windsor, York, and Peel. And they say they are hoping to soon see Ontario's death rate plummet. The Premier calling it the single most important tool in the fight against COVID-19.
Nothing else matters right now.
But critics say there are other tools the Premier should be using now to slow the spread. Opposition leader Andrea Horwath renewing calls for paid sick days in Ontario.
Some of these workers literally cannot afford to miss a single shift. And many of these workers work more than one job, as a matter of fact.
The Ford government says paid sick days should be the federal government's responsibility.
It's not a hard thing to do. Paid sick days are necessary. Continuing to lob things off to the federal government is not acceptable.
The province says residents and staff of long-term care homes who have received their first doses are guaranteed to receive the second dose in 21 to 27 days despite the delays. All other recipients of the Pfizer vaccine may have to wait up to 42 days before getting their second doses.